Breaking news in the path forward, the state of Alabama learned it will be getting much less of the Pfizer vaccine than originally anticipated.
NBC 15's James Gordon joins us now. He spoke with Alabama's top doctor about how the state plans to hand out the vaccine.
James, the state lost out on thousands of doses.
It did, Andrea. The state hopes to receive about 41,000 doses of the vaccine by December the 15th. That's about a third of the 112 that were originally expected of those doses. This means early vaccines will be in short supply. A CDC advisory panel is recommending healthcare workers and residents of nursing homes should be at the top of the list. Alabama's top doctor agrees.
Those two groups are the people that, one, have the most risk for exposure, when you talk about healthcare workers, and then two, have the most risk for serious outcome.
Ultimately, distribution decisions are up to state leaders. While CDC recommendations are expected to be followed, they can be adapted. Alabama is in the process of finalizing its distribution plan and will have more details 4 to 5 days from now. The first wave of Pfizer vaccine will be extremely limited.
Each vaccination series actually requires 2 shots, not 1. And so, 40,950 doses is a lot less than we had originally thought we were going to get.
Dr. Michael McBrearty is with Thomas Hospital in Fairhope. Based on what he is seeing day to day at the hospital, he recommends the state vaccinate frontline workers first.
I'd advocate that basically the first responders and the healthcare workers and their support staff be first up. Now, it sounds self-serving, but I think it's in the good of the community.
This week, frontline workers at Thomas Hospital are being surveyed, asking doctors, staff, and employees if they will volunteer to take the shot or not. Most Americans will likely have to wait until spring. It comes as top infectious disease experts look to build public trust in a vaccine developed and set to be delivered at warp speed.
I think people are jumping on it like crazy because I'm having calls daily now from my own patients wanting to know when I'm going to get the vaccine. I don't even have an option for it right now because it's going through the states and it's allotted by apparent needs.
Right behind the Pfizer vaccine is the Moderna vaccine, which should make up for those limited numbers. Meantime, the CDC advisory panel will meet again next week, in the next several weeks, that is, to decide who will be in line next. Now, among the possibilities, teachers, police officers, firefighters, and workers in food production and transportation, the elderly, and people with underlying medical conditions. For now, we're live in Baldwin County. James Gordon, NBC 15 News.